My name is Nomusa Kumalo. I suffered a stillbirth, but I've had previous stillbirths. It was not the first, it was the third actually.
So the goals of CHAMPS in South Africa is the same as it is in all of the CHAMPS sites, and that is really for us to get a much more granular understanding in terms of the causes of death. Although significant progress has been made over the past 20 years in reducing the number of children under the age of 5 that die, almost a halving of the number, another big component of CHAMPS is also about addressing what is largely an ignored pandemic, and that is the large number of women that unfortunately will have a stillbirth.
We have a large prevalence of hypertension in pregnancy in South Africa, and that's resulting in women going into premature labor. The other important part of this is the stillbirths. Mothers who are hypertensive also have an increased risk of delivering a baby that's born stillborn. And because of that, to prevent stillbirths, to prevent premature birth, one needs to focus on the pregnant woman.
I think understanding early mortality means that you need to understand what happened during pregnancy. And findings from MITS has showed us that a great proportion of stillbirths and early neonatal deaths are due to maternal underlying factors. So understanding what happened in pregnancy and ensuring a healthy pregnancy improves neonatal mortality and improves stillbirths.
And this is something that CHAMPS certainly is actively pursuing. Understanding what are the causes of the stillbirth, which again would assist us in determining what type of interventions need to be implemented or what type of research is warranted to further unpack what the causes of those stillbirths are.
And in South Africa, our focus is therefore shifted towards the pregnancy in an attempt to uncover what is going on during pregnancy that increases the risk of these poor outcomes for the baby.
MITS is minimally invasive tissue sampling. This is when we take biopsies, so little samples from a child who has died, who's less than 5, or is stillborn, and we take samples from the lungs, the brain, the liver, and we send these off for testing to try understand why the child died.
So I think CHAMPS is very helpful because it gives us the granularity in terms of understanding why are children dying. So we get that information from the mother, either collected from the file. So as part of the DECODE panel, we also look at those studies, post-mortem studies, which would include cultures, histopathology, PCR, and immunohistochemistry. So we're looking at all those factors, and we put it together, and we say what is the most likely cause of death.
Of the losses during the pregnancies, I had high blood pressure and I also had gestational diabetes. So I think they were a huge factor because all of the pregnancies, it was detachment of the placenta and also preeclampsia. So they said the high blood pressure is the one that contributed to all of that.
The learnings for CHAMPS are informing practices. They are changing policies. For example, a simple intervention has resulted in a shift in that. Nurses at primary healthcare levels at antenatal facilities will be able to prescribe aspirin for women with preeclampsia or hypertension at risk of having a poor outcome.
How CHAMPS is then informing the decisions that we make is that it helps me to then prioritize the programs I need to focus on, but also the activities within the programs that I need to focus on.
So CHAMPS is being transformative in terms of contributing to our understanding of the causes of under 5 childhood death, as well as highlighting what are the major touch points that we need to start focusing on if we are serious of wanting to bring about further reductions in under 5 childhood death, but also further reductions in terms of stillbirths. Essentially, as an example, a major focus in the research unit right now is on Klebsiella pneumonia and a vaccine against Klebsiella pneumonia. And that type of research we wouldn't even have given a second thought had we not been involved in CHAMPS. I don't think there's an equivalent program before CHAMPS which would have provided the same detail of information as CHAMPS is providing. And I think that's important.
With CHAMP, they're actually going to the root of the problem, that I've got that belief that if I do fall pregnant again, it's going to be probably a successful pregnancy.